Is it normal for people's rib cages to be different?
Right there is tender.
Yeah. That's weird.
All right, let me see here.
I feel even now.
Is that a little better?
Mm-hmm.
Okay, here.
A lot better.
Let me just tell you a secret, okay?
Mm-hmm.
You're not the one who's craving it. It's the fungus that lives in your stomach that's craving
I
it.
have a fungus. I knew it.
Hard. Okay, relax. All right, push your knees out to the side. Push them out. Push, 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 push. Okay, relax. Okay, hold them together again. Hold your knees together. Hold them together. Hard as you can. Hold them together. Don't let me pull them out. Hold. Harder. Okay, one more time. Push them out. Push, 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 push. Relax. Okay, and hold. Hold your knees. Hold. All right, so I'm going to do a pulse reading, okay? Mm-hmm. This is an Eastern pulse reading. So in Western pulse readings, they just use the one finger, one spot, and they just basically measure rate. They're supposed to measure rate, rhythm, contour, and amplitude, the four characteristics of the pulse. No one does it anymore. Maybe a very seasoned...
I haven't heard of that.
No? Well, it's because you're in cybersecurity. Yeah.
Touche.
So, yeah, it's a... Anyway. Rate, rhythm, contour, and amplitude. What are they talking about? Okay, so in Ayurvedic medicine and traditional Chinese medicine, they have a 3-pulse reading. So there's 3 different pulses. Each pulse has a different feel to it, or a different contour. And they use both sides, and there's a superficial and a deep. And so there's 6 on each side. And that's 12 total, 12 organ systems and meridians. So I'm going to do a reading here on the right side, superficial first. This is the small intestine. This is the stomach. This is the adrenal glands. Can we go down to the deeper layer? This is lung, spleen, and the organs of reproduction. Okay, so that all feels pretty good. So, no lung issues ever, no bronchitis or anything, no immune system issues.
No.
Not a sickly person, stay pretty healthy.
Yeah.
Reproductive system, periods are on time, normal. Mm-hmm. Okay. The only place that it is, it's strong. It's not strong, but it's consistent for the most part. But it kind of comes in and out. And so the signature suggests here, this is the adrenal gland, but also the thyroid too. Okay. All right, so let's talk about adrenal gland first. How's your energy levels and fatigue?
Oh, I'm always exhausted around 2.
Around 2 o'clock? Mm-hmm. Okay. All right, so...
Like, no matter what. I could drink an energy drink and go right to sleep.
Do you wake up at the same time every day, or does it matter? Okay, so I have to look at another chart to see what's happening at 2 o'clock as far as the metals. I don't know that off the top of my head, but... Mm-hmm. All right, so thyroid. Have you ever had your thyroid checked?
Yeah, but it was like a long time ago when I was in high school.
What did they check it for?
To see why I was gaining so much weight. I was just fat.
Okay.
I weighed over 200 pounds.
Really?
Yeah.
Okay. Mm-hmm. Was it a dietary thing, or you just...
Yeah, I binge ate, I think.
Oh, okay.
Yeah.
Do you remember binge eating? Like, you just unconsciously binge eating?
No, I just I liked food a lot, and so I would get my my serotonin boost from it. Food makes people happy.
That's true. Food should make us happy.
Mm-hmm.
All right. Interesting. adrenal gland, thyroid. Okay, I'm gonna push down a little bit into a different layer. So we did superficial and deep. We're gonna do a different layer here, which gives us a different reading of a different system, the energy systems. You ever hear the chakras? You know what they are?
Mm-hmm.
Okay. Is it okay if I read your chakras?
Yeah.
6. It's interesting. Pineal gland. I look at that one a lot. Third eye.
Mm-hmm.
You afraid of the future?
No.
You know what's coming or what?
No.
You have any clairvoyancies?
Not that I know of.
Yeah. Do things hit you by surprise a lot?
No.
You're kind of,
I get like a gut feeling and I'm like usually right about it.
Okay.
But I don't like know. I don't know.
Right now you don't know.
Yeah.
You have an uncertainty in your life right now.
Correct, yes.
Is it everything that we've already been talking about this whole time?
Yeah.
All right. So it was already coming out.
Mm-hmm.
Okay. That's fair. I can't necessarily work on that, okay? But you know probably already that it's like that's like an outside thing.
Mm-hmm.
You know what I mean? So
Yeah.
all you can do is create a balance on the inside.
Mm-hmm.
You know, so that you're not overreacting.
Mm-hmm.
That's it. Yeah. But also too, like, you know, not having expectations is one thing, but you're also allowed to have standards.
Yes.
Yeah.
And I do have those now. It was an issue.
Okay, what was it?
I just let people walk all over me.
Oh, okay, good. You have boundaries now.
Yeah. Oh, yeah.
Yeah.
Yes. Yeah.
Okay. All right, I'm going to palpate your abdomen. Is this the same butterfly in motion, or is it 2 butterflies?
2 butterflies.
Okay, let's see. Okay, 2 things.
Mm-hmm.
Yeah. All right, so number 1, there's an inside out, and number 2, there's an outside in. Okay.
Okay.
So the inside out is like all of the manifestation that you hear about these days. You know, actualization is important. But the catch-22 is that you can't. I don't want to say you can't control other people that way,
Oh, yeah.
but you certainly can create circumstances. I'm not saying to be manipulative, but everything is manipulation to some degree. But it's okay to continue to communicate, number 1, internally with yourself, dialogue, find your boundaries, know what your standards are, and then communicate them outward. And then there's a inside out. No, I'm sorry. And then there's an outside in, which is whatever's happening is not under your control, and you have to accept and love what is. Is that a little better?
Mm-hmm.
Okay, here.
A lot better. That's odd.
Plug that in there. Okay, I'm gonna touch your shoulder here. A little tender up here?
Uh-huh.
Tender, huh?
Mm-hmm.
So they did diagnose you with IBS once before?
No.
Okay.
I was trying to understand the question. When you were asking them earlier. I was like IVF, that kind of thing.
Oh, okay. This one's not too bad over here, right?
Mm-hmm.
Okay, so it's for the stomach. I'm going to palpate your abdomen here. Okay, put that arm down. Okay, I'm going to hold this other shoulder over here. Tender?
Mm-hmm.
Okay, let's do some belly breathing here. Okay, you're going to breathe into your belly. No.
No, that's my chest.
Yeah. You know how to do this, right?
I don't think so, no.
Let's see, push your belly out. Okay, now relax. Now breathe in and push your belly out. Almost. Okay, it's tough when you don't practice, yeah. There you go. Now breathe out and pull it back in. Breathe in. Good. And out. Good. Two more. Do it 2 more times. And out. In. And out. Good. In. Out. Deep belly breath.
I have to really think about it.
It's good. This is a good practice. This is a good meditative practice. It's really good for your digestive system. When you breathe with your diaphragm like this, your diaphragm moves up and down.
Mm-hmm.
It changes the pressure in the abdominal cavity, and it increases gastric motility. So you can feel all this movement that's happening. Gastric motility is a good thing for digestion. The diaphragm also attaches to something called the central tendon, which directly attaches to your heart, your pericardium. And when you use the diaphragm to breathe, it very gently massages that pericardium, and it causes the heart to decrease. It stimulates it stimulates a sedative effect in the heart, so it calms your heart down, decreases your heart rate. So just by breathing like this, that you get better digestion, so which means you have more nutrients available. You get better movement of your blood, so you have more oxygen available, plus you're breathing better, so more oxygen is available. More oxygen, better nutrients. Those are the tools that your body needs to do things like balance hormones and Balance your mood. Okay, let's see here. All right, do me a favor. Take your other hand and then just like move this apart. Move them apart from each other. I'm going to do a reflex that's right in the middle of your sternum, okay?
Yeah.
Right there, it's tender.
Yeah.
Okay, you're going to just breathe. A little bit still, right?
Mm-hmm.
A little better?
Mm-hmm.
It's kind of a lot better, isn't it?
Yeah, a lot better, yeah.
Okay, let's see. You put your hands down. All right, let me see here.
You feel even now?
Oh, yeah. Oh, that was the thing, right?
Yeah,
Oh, yeah.
yeah.
We forgot to check it before I fixed it. Oh, well.
Yeah. That's weird.
Yeah, your diaphragm is a big one for you.
Yeah.
Yeah. All right, let's do this. Put this arm up in the air. Okay, hold that right there. Make it strong. Don't let me push. I need to do left. Balancing it. Okay, one more time. Okay, now relax. All right, I'm gonna do. So there's adjustments in chiropractic that are for the cranium. Okay, so I'm gonna work on your skull a little bit now. Okay, the first one that I have to do is called the palatine bone. This is your hard palate. Okay, so this is going to be a adjustment that I do from the inside of your mouth.
Okay.
So
That's the one that everybody's like.
no, it's not that one. Okay, that's funny though. Okay. That's the second time in a row. Someone's like, I don't want to do that one.
I don't mind.
We're good. That one's only for people who.
I don't have a problem with that.
All right, so go ahead and say Oz. Open your mouth. Stick out your tongue. Put it back. How much sugar do you eat?
A lot.
Okay.
Why? Why?
Okay, that's okay.
Why?
Oh my God, it's actually a really good potential. Like that means you're.
I crave sugar all the time, especially chocolate.
Let me just tell you a secret, okay?
Mm-hmm.
You're not the one who's craving it. It's the fungus that lives in your stomach that's craving it.
I'm a fungus. I knew it.
That's why you're tired. It might be why you're tired too.
Probably.
All right, so go ahead and say ah. All right, so this is the palatine bone, okay? So this is the maxilla right here, okay? But then if we go back to the last tooth right there and slide over, there's the palatine bone. So this is all the way in the back. You're doing pretty good there. You're just going to hold on. I hold this bone. And cranial, the respiration does the adjustment. So you're breathing. That causes the cranium to expand and contract. That expansion and contraction changes the pressure, which helps pump cerebral spinal fluid, which is the fluid that your brain and spinal cord are bathing in. There's the movement in your stomach that I've been waiting for. All right, let's see. Put your hand back up. Put your arm back up. Okay, make it strong. That's good. That's your sphenoid bone. Excuse me. Okay, now I'm gonna do some adjustments to a bone in your neck. Okay, it's called your hyoid bone. Okay, I'm going to adjust underneath of the sternum here. This might sting just a little bit. This is a clavicle adjustment.
Yeah, that's tender.
Right there. Sorry, I forgot to warn you.
I was like, that was a weird feeling.
Okay, put your arm out again to the side. Push up against me. Okay. All right, okay. You need to focus right here.
Mm-hmm.
Just
Very
like
high.
you close your eyes and you breathe, and then you focus your energy right here. You just focus on this point. Not focus your energy, just focus on this point. You imagine it, you feel it. And while you're focusing on this point, you envision the changes that you need and want in your life. You envision the direction. And by focusing right here and using your vision, you point your sail. Then you just have to wait for the wind. Put your arm out to the right again. Push up against me. Okay. So we're going to do some sound meditation here. Sound is a powerful bringer of health and balance because sound is the vehicle for consciousness. So as long as you're paying attention to the sound, that means you're present in the moment, and the moment is the most potent time to, they say, manifest your reality, but it's really actualize your intention. So if you have any intentions that you'd like to put a pin in, and if you'd like to cast out a favorable outcome for your future, okay, this is a really big deal for you because this is the chakra that the phase that you're in right now. It's not blocked, it's not weak, it's just the phase that you're in right now, and that's seeing what you want in your future. And then using your actions and your words.
100%.
What's that?
I said 100%.
All right, so we're just going to allow this moment to bring us the medicine for that part of your life, okay? So all you have to do is stay present, listen to the sound, and then if your mind starts to wander off on other things, just gently remind yourself to come back to right here, right now.